Everything we do has a positive or negative effect on ourselves or others. Let's try to make the right decisions as we aim to limit the spread of COVID-19. Stay tuned to learn how you can play your part in doing this. I am Adrian Atkinson, and this is Jamaica Magazine. The news is right after the break.
Create, design, share, and win prizes with your art in the Office of Disaster Preparedness and Emergency Management ODPEM Digital Poster Competition. Posters must be titled and themed Hurricane Preparedness. The competition opens August 13 and closes September 4. To enter, you must be a student between 12 and 18 years old. For more information on contest guidelines, visit our social media pages, website, or just give us a call. It's ODPEM's Digital Poster Competition.
Good day, I'm Stephen McHugh, and this is your JIS News for Thursday, September 3. The polls opened at 7 this morning as Jamaicans went out to vote for their next set of parliamentary representatives in the general election. The Electoral Office of Jamaica, EOJ, says voting took place in 6,984 polling stations across the island. There are 139 candidates vying for a seat in the 63 constituencies, 108 of them male and 31 females. The Jamaica Labour Party and People's National Party are both fielding 63 candidates each, while there are 13 independent candidates contesting. The election is being observed by local observer group Citizens Action for Free and Fair Elections, CAFE, and a small delegation from the European Union. In light of the COVID-19 pandemic, the EOJ put an election protocol in place which, among other things, required electors to wear a mask, submit to temperature checks, frequent hand sanitization, and social distancing from other voters. Preliminary counting of ballots begins inside the polling station right after the polls close at 5 p.m. The Ministry of Health and Wellness has confirmed another significant jump in Jamaica's COVID-19 cases, as well as another 3 related deaths. The deceased are an 82-year-old male from Clarendon, a 75-year-old female from St. Catherine, and a 65-year-old male from Kingston and St. Andrew. All cases reportedly had comorbidities, namely diabetes and hypertension. This brings to 27 the total number of COVID-19 related deaths in Jamaica, while one other death remains under investigation. The Health Ministry's September 2 COVID-19 update revealed 139 new confirmed cases, bringing the total cases on record for the island to 2,822. Most of the new cases were recorded in Kingston and St. Andrew, St. Thomas, and Manchester. The latest update also reveals another 2 recoveries, making it 900 persons who have now recovered and been released from care. There are 1,822 active cases across the island. President of the Jamaica Hotel and Tourist Association, JHTA, Omar Robinson, says there is no known case of COVID-19 transmission within the tourism industry, despite the uptick in cases across the island. He insists that since the reopening of the tourism industry on June 15, hotels have been adhering to the extensive established set of safety protocols put in place by government.
I've been to a number of hotels. The employees are wearing masks and or face shields. There are the barriers, the plexiglass barriers, put up at certain guest contact areas. There is physical distancing in the restaurants, at the bars, a number of other measures. And to date, I sit here today and I'm proud to say within the industry, there is no known case of transmission from the visitor to our staff.
The JHTA's president was speaking at a JIS think tank held at the agency's regional office in Montego Bay on Monday. Mr. Robinson says other players within the established resilient corridor set up for tourists, including attractions, have been playing their part to ensure visitors and staff are fully compliant with the COVID-19 protocols. He has issued an appeal for Jamaicans to begin to take personal responsibility in the fight against COVID-19. The Mandeville Regional Hospital is implementing new measures to better manage the number of patients and clients in the facility, improve physical distancing, and reduce the wait time. CEO of the hospital, Alwyn Miller, says that starting next Monday, September 7, the outpatient department will only accommodate 120 patients inside the waiting area beginning at 6 a.m. As the number of patients decrease, other persons will be allowed in the department. He says provisions will be made for patients to wait external to the facility. Special accommodations will also be made for the elderly, pregnant women, mothers with babies, and physically challenged persons. Patients requiring assistance should be accompanied by only one relative. In addition, Mandeville Regional Hospital will implement a new digital appointment system for select clinical services during September, which will be phased over the next 6 months. The hospital CEO says the system will allocate specific appointment times for patients, which will result in them being allowed entry to the hospital closer to the time of their appointments. He is encouraging the public to adhere to the changes which are meant to protect public health. Over 1,000 school leaders are being trained on how to implement the COVID-19 protocols in schools. The National College for Educational Leadership, NCEL, is undertaking the training. Director of NCEL, Dr. Tanisha Ingleton, says school leaders have been exposed to the college's newest learning product, 3R Framework, which stands for Regroup, Recondition, and Rebuild. It is a short online course designed to equip school leaders with practical tips, tools, and strategies as they prepare for teaching in the midst of a global pandemic. There are 11 areas of focus, which include classroom space and physical distancing, mealtime and recreation, group size and staffing, hygiene and cleaning, and curriculum modification. Though it is not mandatory, Dr. Ingleton is encouraging more school leaders to register for the free course on NCEL's website at ncel.gov.jm. And finally, the Justice Training Institute, JTI, is working to restart its court reporting program to fill the need for more court reporters in the justice system. Director and principal of the JTI, Karen Campbell-Basco, says that with so many vacancies in this area, employment is almost guaranteed for those who successfully finish the program. Court reporting is a 2-year program that requires participants to type at a particular speed and with an accuracy level of 95%. The minimum entry requirements for the training program are passes in at least 5 CSEC subjects, with English language being compulsory. Applicants will also be subject to background checks, a medical, and a discussion to ascertain whether they're suitable for the position. JTI's director and principal says the Training Institute is even willing to try and help applicants meet their tuition requirements for those facing financial difficulties. The JTI is the training arm of the Ministry of Justice and is the only institute locally offering training in court reporting and steno writing. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.
Jamaica Social Investment Fund, JSIF, celebrating over 20 years of investment in community development. JSIF has forged relationships with international funding partners as well as private and public sector entities. Let us continue to invest to reduce vulnerabilities. Let us build our social capital and resilient infrastructures to ensure full participation in Vision 2030. JSIF, investing for community development. As we work to create light for others, we naturally light our own way. In times of hopelessness, government initiatives such as the Housing Opportunity Production and Employment Program are here to provide hope, regardless of your situation. Let's take a look at this next feature and see how our youth are being helped to move from homeless to hopeful.
Growing up, I didn't have no parent, nowhere to go. I was just stranded. I started to live in Crossroads because I didn't have nowhere else to go. So what I would do when I'm at Crossroads, I would stay in Mothers by day, and by night I would get a piece of cardboard and sleep at the bus stop beside of Mothers in Crossroads. I will walk and beg, or I will stay in Mothers for the whole day, begging passbys or so forth, till I find myself again money now, so I'd always have a phone. So I use that money that I get, buy credit, put on the phone, and put on service, data, and find out about all of the ministries and so forth. And I will sit there and call the different ministries, from the Chief of Defense Staff Office to the Minister of Education, the Prime Minister's Office, all of those. So I keep on calling till I call the Prime Minister's office again, and as secretary, I talk to her till I tell myself, say, I can't take it no more. I start crying, I tell the lady, say, miss, please just help me. Please, I beg you, help me. And the lady say, young man, I will guarantee you that I will help you. So don't worry yourself. She called me back like an hour after or so forth, and she said to me that I got to a person that I think will most likely help you in your situation, which his name is Mr. Martin Rickman. He is the head coordinator of the HOPE program. An hour after, Mr. Rickman called me, and he introduced himself, and I introduced myself, and I tell him my story all over again. He told me that he can help me out with something to do, a skill and a job or so I can gain some form of income, so I could buy hygiene products and clothes and so forth. So he directed me to the Art and Ripon Road, where he told me to bring all relevant documents like ID, TRN and so forth to that place on Ripon Road, and speak to the secretary and tell her that Martin Rickman, the head coordinator of the HOPE program, sent me here. He told me that I should go to a school that's on South Camp, UWI Open campus. I went for 2 weeks. After the 2 weeks, I spent at UWI Open campus at South Camp Road. I then moved on to a government agency for work. I started off processing in the computer all documents that come in. I will be the one who to lodge it in the computer and send it off to the different departments. But now I'm a customer service rep at the moment, because my supervisor told me that my talent is wasted where I'm at right now. I don't do much more than lodge the documents in the system and so forth. So she gave me more hands-on training that would more fit my criteria.
I think it is a good motivator in the sense that, it gives them some purpose of living, coming, doing something, knowing that he's responsible for something that is such a vital aspect of our daily activities. He dresses well, always on time, and he takes pride in whatever, what is assigned to him. Meaning he works really hard, and whenever he's not here, they miss him.
This particular day now, I think it's the following week, after Martin Rickman helped me out with the HOPE program and so forth. I saw a lady, just a random lady, I was begging and so forth. And the lady see me and she started to talk to me and ask me, why am I here and so forth. So I told her and I spoke with her, and she take me into Mother's, she buy me a patty and a juice. And we were talking, just talking and talking, and then she asked me, do I want to come to stay with her? With a glad face, I accepted and said, yes, I would love to come home with you. When she took me in, it's like, I was very welcome, because just looking, I had a bed to sleep in that used to be a cardboard. I had food to eat that used to be me begging on the street just to make ends meet, just to eat a little patty or something. I had dumpling, she gave me all type of food that I longed to eat from a longer while.
You know the reason why I do it? God himself provide for me. That's me can feed myself, feed him, feed my 2 grandchildren then. Helping him is not a problem. Helping somebody when they are in need is the greatest thing for me.
I can put my life like the Titanic, if you ever seen that movie. It's like, you know, when the ship was sinking, there's a lot of persons like, them don't know what to do. Some people just jump off in the water because them can't. But I was there and like the ship has sink, and it's like I tell myself, say, you know what, I'm not going to make this ship sink with me now. So I decided to just jump off. So when you jump off now, I decide say, you know what, I nah give up, I nah just drown so, I nah just go down so. So I tell myself, say, you know what, I go swim. Till I see a light, and that light was Martin Rickman, who shine a lot of other lights for me to a lot of different islands, a lot of different places.
Whatever illness you might have, it is important to visit the doctor at the earliest sign of sickness. For many conditions, early detection can lead to better outcomes. Don't stay at home and self-medicate and allow your condition to worsen before going to the doctor.
If you are a youngster, young child, 14 and younger, older person, or you have a compromised immune system, you have an underlying illness, a cancer patient, a diabetic patient, then your system is compromised. You need to see the doctor quickly and let the doctor prescribe.
Visiting your doctor early protects your health, so you can enjoy more moments, more life.
Children are, of course, affected during this COVID-19 pandemic. Help your little ones to understand what is happening. Ensure they are informed but not anxious. This next feature will help you to do just that.
Families across the country are adapting to the evolving changes in daily life caused by the COVID-19 pandemic, and parents and other caregivers are faced with helping families adjust to the new normal. This includes trying to keep children adequately informed during the outbreak. If you want to know how you can ensure that your children are equipped with the right amount of information they need about COVID-19, follow these next steps. The first thing you have to do is make time to talk to them. Talk to your children daily about the latest news and updates, and be sure to let them know that they can come to you if and when they have questions. When talking to children, ensure that you use words and sentences that are most suitable for their age group. This is the only way to ensure that the child receives and understands the information being shared. Let your children develop the habit of watching the news with you, but ensure that the information is credible and that information overload does not occur, because this can lead to anxiety. The outbreak of the coronavirus has brought with it numerous reports of racial discrimination around the world and general misinformation. So, it's important to check that your children are neither experiencing nor contributing to bullying. Make time to clarify all rumors and discriminatory claims. Explain to children how they can stay safe during the period. Talk to them about the importance of a balanced diet, social distancing, hand washing, sanitization, and other important safety measures. Children may inevitably become worried about all the changes happening around them due to COVID-19, but it is your duty as parents to assure them that steps are being taken every day to keep them safe. Impress upon them that, rather than be worried, they should be prepared.
The first case we had was of 7 Indian nationals who were trafficked, and where they were found, they were living where the dogs were living. They were not fed, just given scraps. So those are just some real male stuff.
If you know of someone who is being trafficked, call the Counter-Terrorism and Organized Crime Arm of the Jamaica Constabulary Force at 876-967-5627 or 876-967-1389.
Due to the COVID-19 pandemic, many parents are now working from home and are able to spend even more time with their children. The future leaders of Jamaica have some pointers to help you keep your children safe and to be great influencers for them. Take a look.
I want you to first begin to look at, who am I? Who am I as a parent?
Future leaders of Jamaica.
Future Leaders of Jamaica started in 2013, and what we try to do is to level the playing field as it relates to opportunities from an educational standpoint by providing resources to our students from low-income families. Whatever the student need, we invest in that student to ensure that at the end of the day, we have a successful product coming out. We actually kicked off our first ever parenting seminar, and we want to make sure that the parents have the tools to be able to help guide them through life. We focus a lot on the parenting to help the parents to be a better you. Bulk of the agenda today, it was really around self-empowerment and self-improvement.
Did you or did you not know, and this is important to know, that human trafficking is a global crime? What we have found across the world, having spoken to global law enforcement, that social media, smartphones and the internet, on top of or under the umbrella of bad parenting, is the main driver here. Back in the day, pedophiles had to go to a school gate to get a victim. Where do you think the pedophiles are now? We rescued a girl from Port Maria in St. Mary recently who met love online. And she was told to meet the person at number 3 Mountain View Avenue in Kingston at a hotel. The person was flying in. It's right at the bumper Mountain View. We got her in. We have across the world 16 ways in which a person can be trafficked. Organ harvesting is possibly of the dead. We can also harvest organs from live people. Debt bondage. This is where debt is either owed or believed to be owed. Child soldiers. Across the world, they are recruiting kids, and we're trying to get that in our law. When the gangsters get kids in, then we charge them for human trafficking. Forced begging. Just last year, we closed our first case in Jamaica of persons who forced others, youths they were, to go on the street in Spanish Town and beg at stoplights. The target age group are usually 14 to 21 years old. And the reason for 14 is because they are perceived to have a longer shelf life. The pedophiles are attracted to them. Did you know, or did you not know, that the average female in human trafficking gets raped 31 times per night? Some more, it's averaging out, some less. So human trafficking will continue if we don't stop it now.
An unhealthy person cannot raise a healthy one. And that's where I'd like to start. Whatever your flaws are, they must understand that as human beings, none of us are perfect. And so as you parent your children, you must be aware that you be human in front of them and say to them, if I've made a mistake, then I've made a mistake. If I have fallen short, then I've fallen short. A healthy human being knows when to be sorry and when to be emotionally intelligent. Allow your children to have the experience of having a problem and having to work through it. Mommy, you know that my friend and I stopped talk? Really? Open up yourself. What happened? Yeah? And allow, just sit there and listen. One of the most important things about counseling is not a counselor telling you what to do, is actually you reaching there by yourself. And another thing, parents, don't be afraid to play. Don't be afraid to play and laugh and teach your children that life is good, right? So, you know, you do a one lick and you run.
It was an amazing seminar. We had about 50 parents today. What's always important for us is to get a good mix. What I did see today, a number of male faces showing up. So it's good to see that the fathers are now stepping into their rightful roles.
It was very enlightening, also informative, and at the back end alarming to hear the statistics revealed by the head of CTAP, Mr. Berry, about human trafficking.
As it relates to the cell phone usage and social media, I would just try to be more knowledgeable of it. You know, I'm a parent of one, my daughter. I will have her teach me a little bit more, and at the same time, I'll inform her of the dangers of it as it relates to human trafficking and other dangers.
Going forward, we'll continue to have a parenting seminar, and we just have to figure out what the topics are going to be for next year, but we're just going to build on this foundation.
Whenever you hear the following tone, the Office of Disaster Preparedness and Emergency Management, ODPEM, will be giving information on an emergency situation affecting the island. Please be on the alert and listen to your radio and television for further information. This was a test of the Emergency Alert System, brought to you by ODPEM.
We have come to the end of another Jamaica Magazine program. For regular updates on what's happening around you, please visit our website, jis.gov.jm. You can also download our mobile app from the Play Store and follow us on our social media pages. Until next time, I'm Adrian Atkinson. Thanks for watching.
This has been a production of the Jamaica Information Service, the voice of Jamaica.